Hey everybody, thank you so much for joining us for another On Call for All Kids, a weekly segment we have here at Johns Hopkins All Children's Hospital, where we're talking about timely topics in pediatric healthcare with our experts here at the hospital. And today we're talking about measles and this widespread outbreak that we're seeing across the nation. We have Dr. Juan Dumois with us here today. He's a pediatric infectious disease physician to kind of break this down for us. So what's going on right now in the U.S., Dr. Dumois?
Right now across the country, there are a bunch of people getting measles, more than what we usually see. Last year, across the country, for the whole year, we only had 372 cases. And so far, just for the first 3 months of this year, there have been 555. And there are 5 areas around the country that have had outbreaks of measles, which is, an outbreak is 3 or more people getting it. And it's usually because someone who was not vaccinated went overseas, got infected, and came back and brought the disease here.
Some of those countries that it's maybe coming from, Israel?
Yeah, Israel, Ukraine. The Philippines has a huge outbreak of measles right now.
How bad can the measles be?
The measles can be very severe.
Okay.
When kids get the measles, about 1 in 20 of them will get pneumonia and end up in the hospital. About 1 in 1,000 can get brain infection from measles, which can result in permanent brain damage. And between 1 and 2 per 1,000 will die of the disease.
Let's talk about the symptoms of it. So if you get the measles, what are you going to see with that?
Early on, the measles looks like a cold. You're coughing, you have congestion in the nose, and the eyes can turn red. And that's several days before the typical measles rash breaks out. It starts on the face and spreads across the body. And we usually don't diagnose it as measles until the rash begins. And people can be contagious with the measles for several days before the rash starts.
How contagious is it, Dr. Dumois?
It is one of the most contagious diseases we know. If you're a close contact of somebody with the measles, like being in the same room, you have a 90% chance of getting it if you haven't been vaccinated.
So let's talk about getting vaccinated. That's one of the ways we can protect ourselves from getting it.
That is the best way of avoiding the measles, is getting vaccinated, because the vaccine is extremely effective at offering protection and it is safe.
So going back to some of these countries that have it, is it not safe for us to go to those, even if we've been vaccinated? I mean, it's most important to be vaccinated.
That's a good question, because although the vaccine is very effective, sometimes the effectiveness decreases over time. So it's really recommended that everyone have received 2 doses of the vaccine. And some people who may have been born before the mid-1980s may have only had a single dose of the vaccine. So if you've only had 1 dose, you ought to get caught up and get that 2nd dose.
How do we find out if we're not exactly sure, have I had that 2nd dose?
Yeah. If you don't have any way to find out your old immunization record or find out from your physicians whether you had that 2nd dose, your physician can do a blood test to see if you have immunity to measles. And if you don't, you go ahead and get that 2nd dose.
And really important too, as an adult, to be vaccinated, because that also protects our kiddos, right? And also those who maybe just are not able to get the vaccination because of their immune system.
That's true, that some people will not respond to the vaccine because they have a weakened immune system. For example, people who have cancer and are on chemotherapy, they just can't respond to the vaccine normally. And babies don't get vaccinated until they're a year old. In the midst of a measles outbreak, we can give the vaccine younger, at 6 months of age, but still, there are always going to be some babies that can't get the vaccine, and so they're protected when the people around them have had the vaccine.
So important to get our vaccinations.
It is.
How can somebody find out if the country that they're planning to visit maybe is having a measles outbreak right now?
So any traveler should go to the Centers for Disease Control and Prevention website, that's the CDC. Okay. And on their main page, you can click on Traveler's Health. And that's where you can look up any country that you're going to go to and look for travel alerts. And they will list pretty up-to-date alerts on whether there's measles in that country.
That's great to know. Last question, this gets brought up a lot of time. We see it in the news. Do vaccinations cause autism?
So, no. And there's been a lot of research to prove that. And one of the largest studies looking at whether measles vaccine can cause autism showed no statistically significant difference, and actually the vaccinated kids were a little less likely to have autism. But in fact, the original article that suggested that measles vaccine might cause autism way back in 1998, that's been retracted. Most of the authors discredited the data, and the main author, Dr. Wakefield, he's had his medical license removed because he was found to have falsified data and not gotten informed consent, just did a lot of things wrong.
So really important that we stay up to date and keep our kids up to date on our vaccinations. It does not cause autism, and we don't want these diseases like measles coming back.
Oh, correct.
Yeah, Dr. Duan, thank you so much. If you have any topics that you would like us to cover and ask our experts questions about, you can just comment below on this video. We would love to hear from you. Or you can visit our website too, hopkinsallchildrens.org/newsroom. We have a lot of information there about pediatric healthcare in general. So we thank you so much for tuning in, and we will see you next week. Thanks again, Dr. Duan.
You're welcome.